Let's be honest, there is nothing more important to a parent than their child's health. And when it comes to their heart, well, any concern can feel absolutely overwhelming. So today, we're going to walk through what pediatric heart care is all about. We'll break down the signs to watch for, what you can expect at a checkup, and the incredible ways specialists care for our youngest patients. Okay, let's dive in.
And that's really the starting point for this whole field, empathy. This quote just gets right to the heart of it, doesn't it? It acknowledges that behind all the medical science, there's a family looking for answers. It's a journey that these medical teams and parents really do take together.
So, let's start with the basics. What exactly are we talking about when we say pediatric cardiology? It's a field dedicated entirely to the heart health of children, and it's pretty amazing.
What's just incredible here is the sheer range of care. I mean, we're talking about a specialty that can start before a child is even born, with fetal screenings, and it continues all the way through their teenage years. It covers conditions that are congenital, which just means they're present at birth, and also issues that might pop up later on.
Okay, this brings us to a really crucial question for any parent. How do you know when you should actually be concerned? Recognizing those warning signs is the absolute first step toward getting the right care at the right time.
Yeah, this is the big one, isn't it? The question that can really keep parents up at night. Is this symptom just a normal kid thing? Or is it something more? Well, luckily, there are some pretty clear guidelines that can help you figure out when it's time to make that call.
So some of these signs are pretty direct, right? Like chest pain or a fast heartbeat. But others are a bit more subtle, like a newborn who's having trouble feeding or looks a little bluish, which could be a sign of low oxygen. A heart murmur that a doctor finds during a regular checkup. That's another very common reason for a referral. And this is so important. Family history really matters. If there's a history of heart issues, being proactive is just key.
All right, so you've decided to see a specialist. What actually happens next? Well, the goal of that first visit is simple: get clear answers. And it all starts with a team that really knows how to work with kids and their families.
And look, this is where expertise makes all the difference in the world. We're not just talking about one doctor's experience here, but the combined knowledge of an entire team. This really represents decades of shared insight, all focused on your child's care. That kind of deep experience brings a lot of reassurance. This just speaks volumes about the quality of modern pediatric care, doesn't it? You have specialists who've trained at top institutions all over the world, bringing that global expertise right to you. But look at the other key things here: a gentle, child-focused approach and consultations in different languages. The point is that communication and comfort are seen as every bit as important as the medical science itself. You hear the words heart tests and, it can sound pretty intimidating, especially when it's for your child. But the reality is, the whole diagnostic process is designed to be as gentle and easy as possible. A lot of the first tests are completely painless and super quick. So let's look at two of the most common tests. You've got the ECG and the Holter monitor. Think of an ECG like a snapshot. It gives doctors a quick picture of the heart's electrical rhythm right then and there. But what if the problem is sneaky and doesn't happen all the time? Well, that's where the Holter monitor comes in. It's basically a portable ECG your child wears for a day or two, and it's perfect for catching those rhythm issues that like to hide. And beyond rhythm tests, doctors have this incredible toolkit of imaging tools. They can use fetal echocardiography to look at a baby's heart before it's even born. A standard echo shows the heart's structure and how it's pumping in real time. For an even more detailed look, a cardiac MRI gives these crystal clear images with no radiation. And then there's the stress test, which shows exactly how the heart holds up during exercise. It's a whole suite of tools to get a complete picture. So, getting a diagnosis is a huge step. But what comes next is just as crucial. Modern cardiology isn't just about fixing problems anymore. It's about managing health, preventing future issues, and really empowering families with knowledge.
This table breaks it down so nicely. Under treatment, you have these incredible, minimally invasive procedures that can fix heart defects without needing open heart surgery. For prevention, screening young athletes is so vital to make sure they can play safely. And then there's education, things like investigating fainting spells to figure out the cause and give everyone peace of mind. And the care doesn't just stop after one procedure. For many kids, it's really about long-term management. This can be anything from fine-tuning a pacemaker to special clinics for high blood pressure and, of course, dedicated follow-up care after a surgery to help ensure a whole lifetime of good health.
All right, in this last section, we're going to tackle some of the most common questions that parents have. The goal here is simple: replace fear with facts and build confidence through clarity.
Okay,
This has to be one of the top concerns a pediatrician hears. A parent hears the word murmur, and your own heart just skips a beat, right? It sounds so serious, but the reality is often quite different.
And here is the really reassuring answer. A huge number of heart murmurs in kids are what they call innocent. They're literally just the sound of normal blood flowing through a perfectly healthy heart, and they're no cause for concern at all. The key, of course, is having an expert listen in and make that distinction.
Here's another one that causes a ton of anxiety. Your child complaining of chest pain. I mean, that's a terrifying moment for any parent. So is it always related to their heart?
Well, most of the time, it's actually not. It can be caused by all sorts of things, from a muscle strain to anxiety. However, and this is the really crucial takeaway here, if that chest pain happens along with other symptoms like dizziness, or specifically happens during physical activity, it absolutely needs to be checked out by a specialist.
And you know, this really brings it all together. The best pediatric heart care isn't just a series of tests or treatments, it's a whole philosophy. It's all about creating a personalized plan, using proven science, and most importantly, making the family an active partner in the entire process.
So, I want to leave you with this. If you have a concern, no matter how big or small, what's the single most important question to start with? Maybe it's this one. What do we need to know to be confident in our child's heart health? Asking that question, it just opens the door to a conversation, and that's the conversation that leads to clarity, peace of mind, and the absolute best care for your child.